Hi, my name is Bryce. I'm going to go over a couple oxygen administration. So first off, as always, we're going to come in, introduce ourselves to the patient. My name is Bryce. We're taking care of you today. Can I get 2 identifiers for you? Name and date of birth? Fantastic. All right, we do have an order for oxygen for you from your doctor. So let me go ahead and get some privacy here. Hand hygiene, down some gloves. Now, oxygen is a medication, so you're going to make sure we continue to use our 6 rights for medication administration and also check the order 3 times. We're going to make sure we actually talk to the patient a little bit and just bring up some of the hazards with oxygen, things like open fire, smoking, etc. like that, so we keep the patient safe. The first option we do have here is called the nasal cannula. This one you are going to be able to use anywhere from 1 to 6 liters of oxygen flow through. So we'll set it up to the oxygen here. You set the prongs to be going in the correct direction. You want to set it up to go up and around here. We can tighten it down, make sure it's nice and snug, but not too tight for the patient. Like I said, this would be 1 to 6. Now, with all of these oxygens, you can be an advocate for your patient. They need humidified air. You can put a humidified attachment on there and just keep an eye on how the water level is. You might have to refill that. Alright, and next we have the face mask. What is nice through this one is that we can have the patient breathe either through their nose or through their mouth. The nasal cannula will need to instruct that patient to breathe in through their nose, out through their mouth. This would be for 6 to 12 liters. For this one, you're going to be actually going around the back of the patient's head. And you can tighten these straps. Now make sure you have a nice, secure, snug fit to your patient. Alright, and for the last 3, they all go on the patient the same way that the face mask had. They just have particular special things about them. We have our rebreather here. This would be your strongest concentrate. Use this for 12 to 15, up to 100% oxygen flow. The key point to this one is making sure you do not put it on the patient until this bag is inflated. If this bag is not inflated, it'll actually suffocate the patient. No air will be flowing through. Then we do have our nebulizer. This one would be used in order to administer medication. There's a capsule down here you would put the medication through, and it would allow the patient to inhale their medication. And last but not least, your most accurate would be your Venturi. The reason why this is the most accurate is they have these attachments in the bottom here, which is going to regulate how much flow is going through. For instance, this one is 50% oxygen, 10 liters per minute. So you'd get your order, what you're supposed to be giving to the patient, put the attachment in, and would give the correct flow the entire time. And that is everything for oxygen. In particular, you just want to make sure you kind of come back, assess the patient, making good points to assess their respiratory as well, and keep an eye on them and make sure everything is all set.